Welcome back to the deep dive. Usually, we are here to broaden your horizons. We talk
No.
philosophy, we talk tech trends, we dig into history. We like to float around big ideas.
We do.
But today is different. Today, we are getting our hands dirty.
We are calling this the survival mode protocol.
Exactly. Because we know who is listening to this specific deep dive. You aren't here for a casual chat while you fold laundry.
Yo.
You are probably staring at a calendar, and there is a massive red circle around a date that is coming up way, way too fast. You have a medical terminology exam.
And not just any exam. We are talking about the combining forms section, the roots, the absolute foundation.
Which, let's be honest, is a polite way of saying the great memorization wall.
All right.
I'm looking at the source PDF you sent over, and it is dense.
It is.
It is pages and pages of Greek and Latin roots that look almost identical. Encephalo, cephalo, cerebro. I mean, it's enough to make your eyes cross.
It feels less like studying and more like trying to decipher an alien language.
Exactly. So, is there a better way? Because if you just try to read this A to Z,
You'll fail. I'm just going to say it. Your brain cannot hold on to that many abstract syllables without context. It's just not how we learn.
so what is the alternative? Because the listener needs to hack this test. They need a strategy, and they need it now.
Okay, so we need to stop looking at them as words and start looking at them as Lego bricks. That is the entire strategy for today.
Lego bricks. Okay, I like that. Walk me through it.
Imagine a Lego set. You have that standard red 4x2 brick. That's a root word, let's say. Gastro.
Okay, gastro.
That brick means stomach. It never changes shape. It is always the stomach. Then you have a different kind of piece, a suffix like adiitis.
Which means inflammation.
Right, and you snap them together.
Yeah.
Gastritis. You didn't memorize a new word. You just built a structure from two pieces you already knew.
So our mission for the next hour isn't to read the dictionary. It's to sort the bricks.
Exactly. We are going to dump the entire bucket out on the floor and sort them by color, or in this case, by body system. We'll give you the mental hooks so that when you sit down in that exam hall, you aren't guessing.
You're building.
You're building.
I love that. We are your audio flashcards, but with much better commentary. Now, a massive disclaimer before we start. This is really important.
Yes, this is crucial. The source is law.
Say that again?
The source is law. In the real world of medicine, definitions can get a little fluid. Context changes things.
But for your test.
For your test, we are sticking strictly, and I mean 100%, to the definitions provided in this source PDF. Even if a definition seems slightly weird or oversimplified,
If it is in the PDF, that is the answer you put on the Scantron.
absolutely, do not fight the test. If the PDF says X means Y, then for the next 60 minutes, X means Y. Period.
Okay, grab your notebook, maybe chug some coffee. Let's enter the command center. We are starting with the head, brain, and senses.
The logical place to start. Now, looking at your source list, we have a bit of a trap right out of the gate.
I saw this. We have two words that seem to mean the exact same thing. First, we have cephalo,
Right. CEPHALO.
and this is the standard Greek root for head.
It is. If you see a baby with a cephalic presentation, they're coming out head first. Or if someone have hydrocephalus, it's water in the head.
Yeah.
That one is straightforward. Cephalo equals head.
But then, just two lines down, we see encephalo with an EN.
Yes. Now, I want to pause here because this is a perfect example of what we just talked about. In the real world of medicine, that prefixing comes inside.
So encephalo should be the thing inside the head, the brain.
It usually is. Encephalitis is brain inflammation. That's the logical leap your brain makes.
But Jed, and this is a big but for the test takers.
Right. We have to look at our source's law rule. Your specific PDF defines encephalo simply as head.
Not brain.
It did not say brain, it says head.
That is just maddening. So if I'm on the test and I see encephalo,
You pick head. Even if your biology instinct is screaming brain, you stick to the PDF.
So for the purposes of this exam, cephalo and encephalo are synonyms.
For this exam, yes, they both mean head.
Okay, mental sticky note applied. Cephalo is head, and encephalo is also head because the PDF says so.
Got it.
Moving inward, let's talk about the actual brain.
Okay, now we get to the brain. We have two major terms here that look very, very similar. Cerebro and cerebello.
They sound like big brother and little brother.
That is literally what they are. Cerebro refers to the brain proper, specifically the cerebrum.
Which is the big wrinkly part.
Exactly, where you do your thinking, your planning, your conscious thought. So cerebro is the main event.
Okay.
Now look at cerebello. It has that extra suffix at the end. In Latin, illum is a diminutive. It means little.
So cerebello is the little brain.
That's it. It's the cerebellum, that tight knotted tissue at the back of your head right near the neck. It handles balance and coordination.
So cerebro is the big brain, cerebello is the little brain. That's a great way to remember it.
It works.
Got it. What about the hard shell protecting all of this?
That would be cranio.
Meaning skull.
Correct, like cranium. Or craniotomy, which is cutting into the skull. Simple as that.
Now, inside that skull, the brain isn't just sloshing around, it's wrapped in layers. The source gives us two terms here. First, meningo.
Meningo. M-E-N-I-N-G-O.
These are the meninges, right? The membranes.
Yes. Imagine the brain is wrapped in saran wrap. Those layers are the meninges. If they get infected, that's meningitis.
So meningo equals meninges.
Exactly.
But the source also highlights one specific layer, duro.
Duro. D-U-R-O. This is defined in your source as duromotor.
Duromator. That sounds like Latin again.
It is, and it literally means hard mother or tough mother.
Tough mother.
Yep. It's the outermost, toughest, most durable layer of the meninges protecting the brain.
I like tough mother. That sticks. Duro is the durable one, the duromator.
That's the hook right there. And deep inside the brain, we have one more specific organ listed, the hypophyso.
That is a mouthful. Hypophyso, H-Y-P-O-P-H-I-S-O.
It refers to the pituitary gland.
Why such a complicated name for the pituitary? It's tiny.
It's the master gland. It hangs down from the base of the brain. The term comes from Greek meaning growing underneath.
Okay, that makes sense.
But for the test, just associate that complex hypophyse spelling with the complex function of the pituitary gland.
And finally, for the head generally, we have the connection between the hardware and the software. Neuro and psycho.
Right. Neuro is nerve. Simple enough. Neurology is the study of nerves.
Okay. And psycho.
Is mind, as in psychology.
So neuro is the wiring, psycho is the operating system.
Perfect analogy.
Let's move to the sensors, the eyes. I'm looking at this list, and honestly, why do we need 4 different words for eye? It seems excessive.
Because English is the thief that steals from everyone. We took oculo from the Latin. We took ophthalmo and opto from the Greek. And now you have to memorize all of them.
Great, let's break them down then. Oculo.
Think ocular or binoculars. That one's usually intuitive for people. It means eye.
Then we have the spelling nightmare. Ophthalmo. O-P-H-T-H-A-L-M-O. That is an absurd amount of consonants.
It is. And catch this. Your source list actually includes a variant spelling. Ophthalmo without the first H.
So they're anticipating people getting it wrong.
Or just acknowledging that spelling standards vary. Just remember,
Yeah.
if it looks like a jumble of P's and H's and T's, it's the I.
Okay, so ophthalmo and oculo both map to eye.
Correct. And we also have opto and optico.
Which also map to eye or vision, like an optician or
You do
optical
plural.
illusion.
Exactly. So that's your group of 4 for I.
Okay, so if I see oculo, ophthalmo, opto, or optico, I'm thinking eyes. What about the specific parts inside? I see phaco, P-H-A-K-O.
This one is crucial because it doesn't look like English at all. Phaco means lens.
Lens. How do I lock that one in? It's so abstract.
Okay, do you know what they call the surgery where they replace your natural lens with an artificial one? Phacoemulsification.
That does not help me memorize it. That makes it harder.
Fair enough. Okay, try this. Phaco. It kind of sounds like fake.
Yeah.
When you get older, your lens gets cloudy. That's cataracts. And you might need a fake lens put in. Phaco.fake.lens.
I need a fake lens. Phaco. Okay, that's stupid enough to work. I will definitely remember that now.
Good. Phaco is lens, and the other part listed,
Retino.
which means retina.
Easy enough. The back of the eye where the image is formed.
There.
Moving to the ears. What are our roots here?
We have 2 main roots for the ear itself. First one is oto.
O-T-O, like otoscope, the tool the doctor shoves in your ear.
Exactly. And the other is oro.
A-U-R-O, like oral skills. So oto and oro both mean ear.
Yes. Then we go deeper to the eardrum. Now, the medical name for the eardrum is the tympanic membrane. So naturally, one root is tympano.
Meaning eardrum. That makes sense, like a timpani drum in an orchestra.
Exactly. It's a drum head stretched tight. But we also have myringo.
Myringo, M-Y-R-I-N-G-O.
Yes. Now look at how your source defines these. Myringo is defined as tympanic membrane and tympano as eardrum.
Wait, those are the same thing.
They are the exact same anatomical structure. But for the test, you have to be precise. The source is law.
So if I see myringo, I write tympanic membrane. And if I see tympano, I write eardrum.
That is how you get the point. Myringo is the fancy name. Tympano is the drum.
Got it. Okay, finishing up the face. The nose.
Rhino.
Like a rhinoceros, meaning nose, easy.
And the mouth, we have 2. Oro.
As in oral.
and stomato.
Stomato. Now, I always want to say stomach here. That stum just tricks my brain.
Don't do that. That's the most common mistake. Stomach has a G, stomato has a T, stomato is the mouth, stomatitis is inflammation of the mouth, not the stomach,
Stomato is mouth. Got it. And inside the mouth, we have odonto.
which is tooth, like an orthodontist who straightens your teeth. Odonto equals tooth.
All right, that is the head and senses. Shake it out. We are moving down. Let's talk about the core infrastructure, the chest, cardiovascular, and respiratory systems.
Okay, let's start with the pump. The heart.
The big one here is cardio,
Heart, obviously. Cardiology, cardiac arrest. That one's a gimme.
but we also have corona.
C-O-R-O-N.
Now, your source defines corona simply as heart.
Right, which is interesting. Most people think of coronary arteries when they hear that.
I do.
And that's because it comes from the word for crown or garland. The arteries look like they are crowning the heart. But for your test, if you see corona, the definition is heart.
Simple as that, okay? And the big pipe coming out of the heart.
Aorta, meaning the aorta.
Easy enough.
Yeah.
Now, the plumbing system, the vessels.
We have a trio here that you need to group together in your head.
Yaku.
Angio, A-N-G-I-O,
Like angioplasty.
vaso, V-A-S-O,
Yeah.
and vasculo.
Okay. Angio, vaso, vasculo. All three look kind of similar.
And they all relate to vessel or blood vessel. The source specifically lists angio as vessel, vaso as vessel, and vasculo as blood vessel.
So they are effectively interchangeable concepts for my exam.
They are.
Great. Now let's distinguish the types of vessels. Arteries versus veins.
Well, arterio is clearly artery.
Easy.
For veins, we have two. First is veno,
Like intravenous. Also easy.
and phlebo, P-H-L-E-B-O.
Phlebo. That also means vein.
It does. Think of a phlebotomist, the person who draws your blood from your vein.
Ah, of course. Phlebo equals vein. Speaking of blood,
We have hemo and hemato.
both mean blood.
Yes. Hematology, hemoglobin, both from that root.
And we have some color coding here for the sols. The source gives us colors.
It does. Medical terms love colors. First is erythro, E-R-Y-T-H-R-O.
Meaning red.
So an erythrocyte is a red blood cell.
Okay.
And then we have leuco, L-E-U-K, meaning white.
Like leukemia, which is a cancer of white blood cells.
Precisely. Now, two conditions of the blood or circulation. First, thrombo.
Thrombo.
It means clotting. A thrombus is a blood clot. So thrombo refers to the process of clotting.
And septico.
That means pertaining to infection.
Like sepsis, a full body infection.
Exactly. Sepsis is a systemic infection. So septico is infection, often in the blood.
Okay, let's breathe, literally. Let's move to the lungs. I think it helps to trace the path of air.
Good idea. So you take a breath, air goes down the windpipe. That's the trachea.
Defined as trachea.
It passes through the voice box, which is the laryngo.
The larynx.
Now, protecting that airway so you don't choke on your lunch is a little flap called the epiglottis. So the root is epiglotto.
The epiglottis. Got it.
The air then splits into the tubes entering the lungs. Those are the broncho.
Bronchial tubes, like bronchitis, which is when those get inflamed.
Exactly. And finally, it ends up in the tiny, tiny little air sacs where the magic happens, the gas exchange. That's alveolo.
Defined as alveolus.
Right. Now, what about the lungs themselves, the actual organs?
There are two roots for that, right?
Two. The first is pneumono
P-N-E-U-M-O-N, with that silent P,
and pulmonio.
and both of them mean lung.
Yes. Pneumonia is an infection in the lung. A pulmonary embolism is a clot in the lung. Both refer to the lung.
Now, looking at the mechanics of breathing, we have phreno,
P-H-R-E-N-O. This is defined as the diaphragm.
the big muscle under the lungs that controls breathing.
Yes. Now, a fun fact, phreno also means mind in ancient Greek, which is why we have the word schizophrenia, which means split mind.
That's interesting. So it has two meanings.
It does, but for your anatomy test, phreno is strictly 100% the diaphragm.
Good distinction. So for the test, phreno is diaphragm. And where does all this sit? In the chest cavity,
Which is thoraco.
meaning chest, like a thoracic surgeon operates on the chest.
Correct. And inside the chest, there's a specific space between the lungs where the heart sits. It's called the mediastinum. So we have mediastino.
Defined simply as mediastinum.
And the lungs themselves are wrapped in a thin membrane called the pleura. So pleura.
Defined as pleura.
See, a lot of these are just taking the anatomical name and adding an O.
Right, those are the free points on the test. Don't miss those. Pleuro equals pleura, mediastino equals mediastinum.
Exactly.
Okay, we are making really good time. Let's head down to the engine room, the digestive system, the whole GI tract.
I think the best way to do this is to just follow a sandwich. Let's make it a narrative. You take a bite,
We're in the mouth, which we already covered. oro or stomato.
Right. You chew it with your odont to your teeth. You swallow. It goes down the slide, which is the esophago,
The esophagus.
and it lands in the tank, the
The
gastro.
stomach.
Now here is where it gets interesting. The stomach does its job, mashes everything up, and pushes it into the intestines. The general term here is entero.
Entero. E-N-T-E-R-O.
Your source defines entero as intestines. Usually it implies the small intestine, but for the test, stick to the general intestines.
Okay. But we do break the small intestine down into 3 parts, right? The source lists all 3.
It does. I call this the DJ ileum.
DJ ileum. Like a disc jockey.
Exactly, it's a mnemonic. D for duodenum,
The duodenum, that's the first part.
J for jejunum,
Jejunum.
the middle part.
And ileum for ileo.
The ileum, the last part.
Watch out for ileo, though. Look at the spelling. I-L-E-O. With an E.
Why? Is there another one that's similar?
There is. Ileo with an I is a bone in your pelvis, the ileum. Ileo with an E is the intestine. They sound almost identical.
Okay, that's a classic test trap. How do I remember which is which? Easy. To eat, you use your esophagus and your ileum. The E is for eating.
E for eat. I love that. Got it. So our sandwich has passed the DJ. Where is it now?
It's moving into the large intestine. The colon.
The colon.
Correct. And finally, the exit strategy. We have recto,
Rectum.
ano,
Anus.
and a combination term, procto.
Procto. What does that mean? Both.
Yes. The source defines procto as anus and rectum combined. Think of a proctologist. They deal with the whole exit assembly.
Okay, so recto is just rectum, ano is just anus, and procto is the combo package.
You've got it. Now, we can't forget the accessory organs that help digestion. They aren't part of the tube, but they dump important chemicals in.
Like the liver.
Hepato, like hepatitis, inflammation of the liver. So hepato is liver.
The gallbladder. This is a long word.
It is. Cholecysto.
Okay, break that down for me.
Chol means bile, and cyst means bladder or sac. So cholecysto is literally the gallbladder, is the bladder that holds the bile.
Cholecysto equals gallbladder. Got it. And the pancreas.
Pancreas.
Pancreas. That's an easy one. And that little vestigial thing that just seems to cause trouble.
The appendix. We have 2 forms here. Appendo and appendico.
And both mean appendix.
Correct.
Now, let's just zoom out to the whole abdominal cavity itself.
Okay, we have abdomino
Which means abdomen. Obvious.
and laparo. L-A-P-A-R-O.
Both aparo. Also abdomen.
Yes. Think of a laparoscopy. That's a type of surgery where they make small incisions in the abdomen. So laparo equals abdomen.
And the lining of that cavity?
That's the peritoneum. So the root is peritoneum.
Defined as peritoneum with a pattern holds. Just add an O. Okay, moving on. Section 4. Filtration and defense. Let's hit the urinary system first.
Okay, the kidneys. We have 2 words for kidney. First is nephro,
Like a nephrologist, a kidney doctor.
and the other is reno.
Like renal failure, kidney failure. So both mean kidney.
Correct. Now, inside the kidney, there's a funnel that collects the urine. It's called the renal pelvis. The root is pyelo, P-Y-E-L-O.
Pyelo, defined as renal pelvis.
Okay.
And the liquid that's produced is uro, which means urine or urea.
Right. From the kidney, it travels down to the bladder.
Yeah.
Now, listen closely here, because this is another trap. The root is cysto, C-Y-S-T-O.
Wait, we saw cyst earlier with gallbladder. Call a cysto.
We did. Cysto generally means a sac or bladder. But in this specific list, your source defines cysto specifically as urinary bladder.
Okay. So if I see cysto on the test, the answer is urinary bladder, not just cyst or bladder.
Precisely. That specificity is key. And the tube leading out of the body, urethra.
Urethra. And it's important not to confuse urethra with urine.
Now let's switch gears to the lymphatic system, the body's defense and drainage network.
Yeah.
Lympho simply means lymph.
That clear fluid.
Exactly. Then we build on it. Lymphadeno.
Lymphadeno. That looks like lymph plus adun.
Exactly. And adeno is a root we need to know on its own. It just means gland.
So adeno equals gland.
Yes. So what do you think lymphadeno means?
A lymph gland.
You're building Legos. It's a lymph gland.
Okay, I see it now. And the next one is lymphangio. We already learned angio means vessel, so lymphangio means lymph vessel.
Perfect. See? You already know more than you think you do.
I am. Lymphadeno is lymph gland. Lymphangio is lymph vessel.
And one major organ in this system, the spleen. The root is spleno.
S-P-L-E-N-O.
Yeah.
Spleen.
Simple as that.
Okay, I think we're at about the halfway mark. Maybe. Let's talk about reproduction. This is a big section with some very specific anatomy.
It is. Let's do the female system first. The general term for women or female is gyneco.
Like gynecologist, women, female.
Now for the uterus. We have a trio of terms here. You need to know all three. Hystero, metrio, and utero.
Hystera, like a hysterectomy is a removal of the uterus.
Right. And a fun, slightly dark fact. The Greeks believed the uterus wandered around the body causing emotional outbursts, which is where we get the word hysteria.
Wow, yikes. Okay, but for us, hystero is uterus.
And metrio, like the endometrium is the lining inside the uterus.
And utero, which is obviously uterus, so all three of those mean uterus.
All three. Hystero, metrio, utero all mean uterus.
Okay, 3 words, 1 organ. Now for the path. The vagina is colpo, C-O-L-P-O.
Colpo, defined as vagina. A colposcopy is a procedure to look into the vagina.
And the fallopian tube is salpingo, S-A-L-P-I-N-G-O.
Salpingo. Fallopian tube? That's a fun word to say. Salpingo.
It actually comes from the Greek word for trumpet.
Does it really? Because the tube looks like a trumpet.
Exactly. The end of it flares out just like a trumpet horn.
That helps a lot. Salpingo is the trumpet tube.
Okay.
Then the ovary, oophoros, O-O-P-H-O-R.
Double O at the start. Oophoro. That means ovary.
And the egg itself, this one is tiny. Ooh.
Just O.
Just ooh, egg. Like an oocyte is an egg cell.
Wow, okay. Oo is egg. Moving up, we have the breast, mamo,
Like a mammogram.
and masto.
Like a mastectomy. So mamo and masto both mean breast.
Correct. Now for the processes surrounding reproduction, mano.
Like menopause, defined as menses,
Mano.
the amnion, the sac surrounding the baby.
Obstetro.
Pregnancy, childbirth, from the word obstetrician. And nati.
NATI. Birth. Like prenatal care is care before birth.
Exactly. Now, briefly for the male system.
It's a much shorter list here in the source doc.
It is. For the testes, we have orcho, orchio, and orchido.
Wait, orchido, like the orchid flower? What's the connection?
Actually, the flower was named after the body part, not the other way around.
You're kidding me.
I'm not. If you look at the roots of some orchid plants, they look like, well, a pair of testicles. So the Greeks named the flower after the anatomy.
I will never look at an orchid the same way again. That is incredible.
So orcho, orchio, orchido all mean testes.
And finally, for the male system, Bolano.
Bolano, defined as glans penis.
Okay. Balanitis would be inflammation of the glands.
Correct.
All right. We are moving to section 6, the chassis. This is the framework. Bones, muscles, and skin. Let's build the
The
skeleton.
main term is osteo, bone.
Standard. Osteoporosis, loss of bone density.
Now here's a tricky one. I highlighted this in red in my notes. Myelo, M-Y-E-L-O.
Why is it tricky?
Because your source defines it as 2 completely different things. Spinal cord and a bone marrow.
Whoa! Those are not related at all. The spinal cord is nerves. Bone marrow is the stuff that makes blood inside the bone.
They are completely different. But to the ancients, they both look like soft jelly inside a hard casing, like the spine or the leg bone. So they used the same word.
That is deeply confusing.
It is. Polymyelitis is inflammation of the spinal cord. Multiple myeloma is a cancer of the bone marrow.
So for the test, if I see Milo,
You must know both. You write spinal cord, bone marrow. It is a guaranteed test question.
got it. Double meaning.
Yeah.
Milo. Okay, the spine itself.
We have spino
Spine, easy.
and vertebra.
Vertebra, one of the bones of the spine.
We also have spondylo, S-P-O-N-D-Y-L-O.
Spondylo. Also vertebra.
Yes. Spondylitis is inflammation of the vertebra. So vertebro and spondylo are synonyms here.
What about the very end of the spine? The tailbone.
That's cocigo.
Tailbone. The coccyx?
Now the ribs. Custo.
C-O-S-T-O. Ribs. Like the intercostal muscles are the muscles between the ribs.
Exactly. The shoulder blade, scapulo.
Scapula.
The pelvis
Calvo.
and the wrist bones, carpo.
Carpal. Like carpal tunnel syndrome in the wrist.
You've got it. Now, how do these move? We need joints. That's arthro.
Joint. Arthritis is inflammation of the joints.
And the cushion in the joints is cartilage. That's chondro, C-H-O-N-D-R-O.
Cartilage.
Fun fact, the word hypochondriac comes from this. It literally means below the cartilage of the ribs. They used to think melancholy and sadness were physically stored there.
That is bizarre. Chondro equals cartilage.
The things that connect muscle to bone,
Tendo.
tendon. And the muscle itself, myo, M-Y-O.
Muscle. Myalgia is muscle pain.
Correct. Now let's cover the whole thing in skin, the integumentary system.
We have dermo and dermoto.
Both mean skin, like a dermatologist.
And cutaneo.
Like subcutaneous, which means under the skin, also means skin,
We also have epithelio.
which is defined as skin surface tissue. This refers to the epithelium, the top layer.
Right. Now the accessories. Nails. That's onycho, O-N-Y-C-H-O.
Onycho. Nail. Think of a claw. It's a weird one, so you have to just memorize it.
Hair. We have tricho, T-R-I-C-H-O.
Tricho. Hair.
And pilo, P-I-L-O.
Also, hair. Like a piloerection. That's the fancy medical term for goosebumps when your hair stands up.
Very cool. And fat is lipo.
Fat, like liposuction.
And two specific regions to finish this section. Axillo.
Underarm. The axilla is the anatomical term for the armpit.
And inguino.
Groin. The inguinal canal is in the groin.
Perfect.
Okay, we've covered all the anatomy. Now we are entering the final stretch. Section 7. I'm calling this the catch-all speed round. These are concepts, colors, substances, directions. We just need to rapid-fire these into your brain.
Let's do it. Colors first. We already did red, erythro, and white. Leuco. Now. Cyano.
Blue, like cyan ink in your printer.
Uh-huh.
If a patient is cyanotic, they are turning blue from lack of oxygen.
Got it. Substances. Litho. Stone. Like a kidney stone is a nephrolithiasis.
Lyco.
Sugar. Glycogen. Hypoglycemia is low blood sugar.
Electro.
Electricity. Electrocardiogram.
Radio.
X-rays. Radiology.
Sono.
Sound. Like a sonogram uses sound to see inside the body.
Cryo.
Cold. Like cryotherapy where they freeze a ward off.
Chemo.
Drug. Chemotherapy is treatment with drugs.
Okay, disease and treatment terms.
Patho and noso.
Both mean disease. Patho, I knew from pathology. Noso is new to me.
Noso equals disease. A nosocomial infection is when you get in the hospital, a disease from a place.
Carcino.
Cancer. A carcinogen is something that causes cancer.
Naga.
Tumor. An oncologist is a tumor doctor. Death. Necrosis is tissue death.
Bio.
Life. Biology.
Iatro. I-A-T-R-O.
This is defined as treatment.
This one is tricky. What's the context?
It often refers to the physician or the treatment itself. An iatrogenic illness is one that was caused by the treatment or the doctor.
Oh, okay. Iatro equals treatment. Got it. And noso. G-N-O-S-O.
Right. Knowledge.
Diagnosis means complete knowledge. Prognosis is knowledge before predicting the future.
Actions and growth. Geno.
To produce, begin. As in, a carcinogen produces cancer.
Islasa.
Formation, growth, development. A neoplasm is a new growth.
Toro.
Development, nourishment. Atrophy is a lack of development. Hypertrophy is excessive growth.
Issue. I-S-C-H-O.
To hold back.
And this usually refers to blood flow, right?
Yes. Ischemia is when blood is held back from an organ, but the core definition is to hold back.
Inciso.
To cut, as in incision.
Time and age.
Chrono.
Time, a chronic illness, is one that lasts a long time.
Pedo.
Pediatric.
Pediatrics, old age.
Geriatrics. Finally, direction and position.
Antero.
Anterior, posterior.
Back, behind.
Posterior,
Side or
lateral. To put, place, position, like a topical cream is put on a specific place on the skin.
cervico.
Important note. The source lists this as neck. It can refer to the neck of the uterus, cervix, or the neck of the body, cervical spine, but the base definition is just neck,
Right. And lumbo.
waist, the lumbar region, the lower back.
One more. Esthesio. I think we missed that one in the senses.
Oh, good catch.
Yeah.
Esthesio, E-S-T-H-E-S-I-O.
Defined as sensation. Like anesthesia means no sensation.
And that, I believe, is the entire list.
Wow. We did it. We actually did it. That was
It's
the
not a
line.
marathon.
But listen, if you are feeling overwhelmed right now, just remember the Lego analogy.
Please do.
You don't need to panic when you see a 15-letter word on the test. Just look for the pieces we just talked about. Find cardio, find gastro, find ionitis. Break it down.
Exactly. You know hemato is blood. You know hematology is the study of hematology. Boom. You got this.
And memorize the weird ones, the
Yeah.
traps. Phaco is lens, your fake lens.
Myelo is spinal cord anti-bone marrow.
And cysto is urinary bladder.
Those are the ones they'll use to try and trick you.
You know, I think it's worth noting that while this feels like a brute force test of memory, it is really an initiation into a language.
What do you mean?
These roots, these Greek and Latin bricks, they are the universal code of medicine. Whether you are a doctor in New York or in Tokyo, cardio is heart. You are learning the lingua franca of healing.
That's a really cool way to look at it. You aren't just memorizing for a test, you're becoming fluent in a global language.
Exactly.
All right, listener, you have the terms, you have the definitions, you have the mnemonics. Now go get the grade. Good luck.
Good.